In this day and age, with family doctors as busy as they are, it is extremely important for patients to advocate for themselves. So if you have symptoms that are concerning you, specifically with respect to your gastroesophageal reflux disease, or if you think you're at risk of Barrett's esophagus and need screening, you need to visit your doctor, talk about your symptoms, and ask them to refer you on for endoscopy or screening. It's important for you to take this into your own hands.
I think it's important for patients to advocate for themselves. And most people know their own body, and they know if something, they have a sense something's not right, or that this is more heartburn than usual, or this seems worse than their buddy has, or that sort of thing. So I think they have to speak up, for sure. Well, the guidelines from the American Gastroenterology Association are basically, as we've discussed, that is max acid suppression to stop the inflammation and stop the ongoing damage. But once they develop Barrett's, they need surveillance. And if they develop low-grade dysplasia, the recommendation is that they get radiofrequency ablation. And high-grade dysplasia, they get endomucosal resection plus ablation.
Cancer Care Ontario, in their new esophageal cancer prevention pathway, recommends screening for Barrett's esophagus in patients who have had gastroesophageal reflux disease for more than 5 years and or frequent symptoms of gastroesophageal reflux disease on a weekly basis, and 2 or more of the following risk factors: age greater than 50, Caucasian, central obesity, history of smoking, and or first-degree relative affected. In patients who have had endoscopic eradication therapy, they're followed by their gastroenterologist long-term in an effort to both assure that they have truly been eradicated and to make sure they don't develop any new lesions down the road. And so they go into a surveillance program as opposed to a screening program for years and years. And so the main role of the primary care doctor afterwards is really just to ensure that the patient stays on indefinite acid suppression with a proton pump inhibitor.